We're going to see the reasons why you should not use contact lenses. This would be patients that use contact lenses have increased risk of having abrasions. Abrasions are straight line defects or shearing in the cornea that present with very painful red eye. There is some risk very little of secondary infection, but this is very painful, and you could just avoid not using the contact lenses because the contact lenses can scar the cornea. Next, the other complication of using the contact lenses is contact lenses keratitis. This is usually due to Pseudomonas aeruginosa. Also could be due to Klebsiella pneumoniae. Here the point is that there would be not only the inflammation or infection of the cornea, but also ulceration. Ulceration of the cornea. The patient presents already with ulceration of the cornea. And this very rapidly progresses to the perforation of the cornea and permanent vision loss. So here the treatment would be immediately topical antibiotics to the eye. Try not to patch the eye, but this is a very severe consequence. It is an emergency, ophthalmologic emergency, because the patient can lose the vision. So there is nothing to lose if we use contact lenses. If we don't use contact lenses, if we use normal glasses instead of contact lenses, and if we use contact lenses and we have one of these things, this would be a extremely painful situation, and I can assure you that the patient, if present with one of these abrasions, is going to say, why did I use contact lenses? Because it's extremely painful. And patients that have keratitis of contact lenses, they are going to feel worse because it is not only the pain but the vision loss. So they are losing in 1 minute what they have already. There is not only to think about probability of how likely is that one of these things happens to the patient that is using contact lenses, but also the consequence of that the normal thing does not happen. The normal thing is that never of these things. But what happens if one of these things happen? There would be extremely painfulness or vision loss. So this way of thinking is the esperanza matemática or mathematical hope. This is, you multiply the probability times the value of the consequence. The value of using normal glasses is 0. There is no benefit in using contact lenses in compared to normal glasses. But there is, if you use contact lenses, now what's the probability that one of these things happen? I don't know, whatever, P. But you need to multiply this times the consequence. What is the consequence, or what is the value of losing this sight? Is a almost infinity value. It is a infinity value. Is not as severe as taking the life of one person's self, but the person is taking out the vision in a sense. That is, we cannot take the risk of losing the vision. That is something that God gives us. God is giving us all the blessings of having vision, etc. And here, because we just want to use contact lenses, we can lose the sight, and we don't have moral right to choose to use contact lenses in order to do it just because we want, because we already now that we know that that we have this risk in using contact lenses. Now it is not morally corrected. The person now that knows this has no moral right to decide to choose or to choose contact lenses. The patient is now morally obligated to use normal glasses, because how the person is going to just of having probability, whatever probability be of having this, how the person is going to take the risk of having these very severe consequences. So we talk about the very awful consequences, and that we need to think not only on the probability but on the consequences.